Hello and welcome to Healthy Wholesome You with Carol. I am so excited to bring you this episode. I have a special guest with me today, and we are talking about diabetes. Diabetes Month is November. November is American Diabetes Month, and we are making sure to do our part to bring you awareness on diabetes. It's so important because diabetes really is at epidemic level at this point. My special guest today is Dr. Kuhu Mitra. Kuhu and I have been friends for almost 20 years. We're great buddies who spend a lot of time together, and I am privileged to have worked with her at a number of organizations. We followed each other around a bit in our careers, and she is an excellent physician by training who has a diabetes story of her own. And so she is here. She will both share with us her own story as well help to educate us on this issue of diabetes so that we are aware and can take action towards better health. So Kuhu, welcome. Why not let us have a word of introduction from you?
Thank you, Carol, for inviting me to your forum. I am Kuhu Mitra. I am a trained pediatrician, and I moved into public health several years ago, and I have been working in the area of maternal health, child health, and family planning all around the globe in the developing world for more than 30 to 35 years. And as Carol mentioned, Carol and I have been both professional and personal friends. So we go a long way. We work together in different projects and different proposals. And now we are doing this episode together, which I'm so excited to be part of, because I couldn't imagine that I'll be doing something like this when we were working together, kind of doing an interview with you and doing something together other than our usual public health work. So yes, it is related to public health, but done in a very different way. So I'm really, really excited, and thank you for inviting me.
Yes, Kuhu, you're more than welcome. And that was a great introduction. So I wanted to start off with a statistic as we get into our discussion. So of note, I mentioned before that diabetes really is at epidemic level. We know that almost 30 million people in the US have some form of diabetes. So that's 30 million who have some form of diabetes. And that represents 1 in 10 Americans. Many people know someone with diabetes, but I don't think most of us realize just how common diabetes is and how many people actually have diabetes. We're talking about 1 in 10. 1 in 4 people who have diabetes don't know they have it. So we have a number of people who are undiagnosed at this point, just walking around with diabetes without treatment, which is not very good. Additionally, another 84 million Americans are at risk of developing type 2 diabetes. So it's really important to bring awareness to this issue. It's really important to talk about prevention, to talk about treatment and management of diabetes so that more people can manage diabetes better. So Kuhu, maybe you can start. Tell us, what is your diabetes story?
Oh, well, my story, my father had diabetes, so I do have a family history of diabetes. And I probably did not take care of myself. And, when I realized I had diabetes, it was pretty late. It was already not in a pre-diabetic condition. It was already full-fledged diabetes with blood sugar level higher than usual. So I did not kind of, rethink and think that my father had it, I should be doing some prevention, etc. I did not do it. And so lo and behold, I am here with a full-blown diabetes case. So I have been having diabetes for more than 20 years now, but I've taken care of myself, so I do take medicines. I do exercises and regular exercise, as well as I, do have a healthy habit of looking at how much carbohydrates I'm taking, how much protein I'm taking. So food is a very important factor if you are a diabetic patient. So I wouldn't be, I've done everything, every activity that's possible along with my diabetes. So I don't feel anything as a diabetic patient because I take good care of myself. However, I do understand that, I cannot take extra sugar or more rice, carbohydrates, etc. And I need to be controlling my food, which is the real cause of, diabetes, how you manage it.
Mhm. Yes, diabetes management can be a bit challenging. All the more reason to also be talking about prevention. Diabetes management does require those food restrictions because carbohydrates in particular affect your blood sugar levels. So for those of you who don't know, there are two types of diabetes. There's type 1 diabetes and then there's type 2 diabetes. Type 1 diabetes is when the body cannot produce insulin at all. And usually it's children who actually suffer from type 1 diabetes, but type 1 diabetes could also be developed by adults. Okay, it could be developed at any age for that matter. Type 2 diabetes, however, is the most common form of diabetes. The body in that case is unable to process the internal insulin well enough to keep our blood sugar levels at normal ranges. So insulin is just a hormone that's in the pancreas. It breaks down the carbohydrates in our blood into blood sugar or glucose. You may hear us using blood sugar, blood glucose interchangeably. It's the same thing. So insulin breaks down carbohydrates into blood sugar or glucose for energy. So for the carbohydrates to turn into energy in your body, you do need insulin. Okay, so Dr. Kuhu, help us understand because I've heard the term pre-diabetic, right? And many people are pre-diabetic, which is they're not quite in the range to be diagnosed as being diabetic or having diabetes. However, they do have elevated blood sugar levels. So how does one become pre-diabetic and then how do they move on to being diabetic from that pre-diabetic stage?
I mean, you need to be cognizant that if you are, for example, if you are obese or if you're overweight, and most of the time you have sedentary habits, your work entails always 24 hours sitting in front of the computer, you're not able to do exercises, you're not able to eat healthy, or you just don't like eating healthy. It can be because eating healthy is another kind of real thing. You have to develop that kind of taste and you don't like it, so you don't eat that way. And these are the factors that the onset of diabetes can start and you are pre-diabetic. And a best way to know whether you are pre-diabetic other than being obese or not doing exercise is when you do your regular checkup, annual checkup. When you are doing your annual checkup, you kind of look at your blood sugar level, fasting blood sugar level, and also the doctor does A1C hemoglobin, which is a very important factor to kind of give you your blood sugar levels the next 3 months, within the 3-month period. It's an average of the blood sugar level, right?
This is the past 3 months?
Past 3 months. Yeah, the day you do it, the past 3 months. So it's an average of your past 3 months of your level of your blood sugar. And that normal range is between 5.7% to 6.4%. And if you are in the middle, like 5.8 or 5.9 or 6 or something, it's fine. You're still not, you are within your range. But if you're in the higher level of 6, 6.2, means you are going towards diabetes. If you're below 5.7, you're in a good range. But when you're falling with that normal range of 5.7, 6.4, you have to see which side your blood sugar level is, whether it's towards 6 or it's toward 5. So that is a great indicator to kind of show whether you're pre-diabetic or not. Otherwise, just by weight or just by, exercise, you won't know. So it's a regular annual checkup of your A1C hemoglobin that actually shows you. Again, fasting blood sugar you can do, but it's one time. So the night before, if you've not eaten properly, your blood sugar can be high. But A1C gives you our average blood sugar level, and that shows whether you're pre-diabetic or you are moving towards diabetes and you need to take precaution. You need to see your doctor, start with your exercise, start with your food habits, but definitely consult your doctor to see whether you fall in the category of being pre-diabetic or diabetic. And I would just add one more thing is that along with type 1, which you mentioned, it's really a very dangerous type of diabetes but there are other ones like gestational diabetes, which can happen during pregnancy. And there is another word of diabetes people don't talk about that too much is diabetes insipidus, in which it's not related to your insulin or but it's just incorrect release of an antidiuretic hormone. So it may not fall in the category of diabetes. Sometimes people do get diagnosed as diabetes insipidus, but it's a different kind of treatment. So you don't have to get worried about it. And gestation diabetes also comes and goes, but as as a person, you might always be cognizant that if you had during pregnancy, you can develop later on. As we are talking about pre-diabetic, that person needs to also take care of the blood sugar and get it checked once a year and follow up.
No, those are some really great points, Kuhu. You touched on so much, but let me try to break it down. So the important number is the A1C number. Okay, and Dr. Kuhu mentioned that if your A1C hemoglobin numbers are between 5.7% and 6.4%, then you are in the normal range. If it goes a little beyond that, then you're starting to go into the pre-diabetic phase, and then much higher than that early kind of borderline stage is when you're really beginning to develop diabetes. Now, pre-diabetes can be treated. Okay, if you get early treatment for pre-diabetes and make some moderate lifestyle changes, whether in exercise or in diet, you could actually begin to reverse that process. You do not have to go on to developing diabetes. So it's really important to be getting your checkups and ensuring that your doctor is that type of testing in your blood work so that you are aware of whether or not you are in a pre-diabetic stage. Because if you are, just a few changes, one study said that just losing 10 to 14 pounds can improve your chances of avoiding or even beating diabetes. So it's really important that you pay attention to that A1C number. So thank you for that, Dr. Kuhu. Dr. Kuhu also mentioned a number of risk factors, being obese being one of them. Losing weight is such a key preventive measure when it comes
to
obesity increases your risk of getting diabetes. So you really want to be sure that if you are overweight or even obese, that you're beginning to lose those extra pounds. So not only is it worth losing the extra pounds, but if you try exercising, maybe what's recommended is 30 minutes per day, 5 times per week. then you can begin to not only lose the weight, but avert diabetes altogether. So Dr. Kuhu, you mentioned gestational diabetes in pregnancy. You mentioned that you can develop diabetes in pregnancy. Maybe just touch on that a little bit, because having gestational diabetes places you at a lifelong risk of developing diabetes. So is gestational diabetes a form of pre-diabetes?
Not really. Sometimes gestational diabetes happens to high-risk women. Like if you are, 35 years or more as a primary gravida, when you're having a first child, if you have blood pressure, if you have other diseases and you are getting pregnant for the first time, your age itself is a high risk. And sometimes during that pregnancy, it's tendency that, based on your endocrinal system, your just pancreas doesn't function in a manner, insulin production, and you have, it's gestational because it happens just during pregnancy. It's a temporary phase. And many people become okay after the child, is born and everything. But it's quite common in high risk cases. So it's quite common in high risk patients to get gestational diabetes. It's nothing that much to worry. But however, since you've developed it once, it's better to monitor yourself in a manner that, you once a year when you get a checkup, just look at your A1C hemoglobin, that you do not develop it. Specifically, this is people who get pregnant at the age of 40 or later than 40, and then they should monitor themselves to the age of 50, that they do not develop gestational, do not, when you have gestational diabetes, but just monitor that you do not develop diabetes in the long run. And also monitor yourself, whether you're obese, whether you're doing sedentary habits, or whether you're doing exercises or not, because sometimes after pregnancy, you just don't take care of yourself so much. And then you fall into that category of, overweight and lack of exercise, lack of sleep. Again, as we can kind of go through the whole process of the sign and symptoms of diabetes, sleep disorder is an important factor that comes into management and treatment of diabetes.
And how is sleep related to diabetes?
There are various symptoms, sign symptoms that happen in diabetes. One of them, initially people start getting very thirsty. So they have excessive thirst, or they have, the patients with diabetes frequently need to urinate because their kidneys are working harder while trying to filter the excess sugar. There is excess sugar in the blood, and the kidneys are working harder to get rid of that excess sugar. And so there is frequent urination. Then there is, sometimes your healing does not happen appropriately. It takes a longer period. You get urinary infections, and there are sleep disorders also you don't get, because as a diabetic patient, what happens is your blood sugar goes up and down. You never have a constant K of blood sugar. There's always the kidneys functioning in a different way, and the insulin reacting, and your body reacts in when it goes up or goes down. Also, when you're eating, the blood sugar goes high up, and sometimes so that sort of reaction happens when you're sleeping. And if you do not sleep properly, it's a vicious cycle that goes on, that the blood sugar goes up and down, and you're not sleeping. Next day, you can't do exercise, you can't. So it's a kind of thing that happens in any disease, but diabetes specifically, well, along with sleep disorder, it's also stress, anxiety. These sort of act as what would you say, as a facilitating factors, which will again make your blood sugar go haywire, because you are worrying, you are stressing out, and your hormonal endocrinal system is working in a different way. So it's a endocrinal dysfunction, right? So you never know how the body is reacting to your stress and anxiety. So sleep, definitely sleep is an important factor to maintain calm and maintain your blood sugar in a proper way.
Yeah, yeah.
I
In
myself feel it, the
Mhm.
days I don't sleep properly, next day when I do my blood sugar, I see it's much higher than expected because I didn't sleep. In the middle of the night, I woke up. And obviously, if you wake up in the middle of the night, you're hungry, you eat. So it's just kind of a constant vicious cycle that goes on in your body.
Yeah, yeah. No, that's really good, Kuhu, because even in my Facebook group, I've been talking to the members there about sleep and weight loss, right? Because sleep does affect weight loss, in that your tired brain does not make very good decisions. That includes food choices, but also in terms of getting some life-saving exercise. You're not motivated for that when you're sleep deprived. So even with diabetes, sleep and fatigue and stress and all these other triggers to your system are causing dysfunction in your body. So that was a really good point. How is dehydration? You mentioned it earlier. How is dehydration a factor in diabetes?
Yeah, because you are always feeling thirsty because it's again, if you see, what are the sign symptoms? You feel thirsty, you drink water, you are frequently going to because the kidney is pumping to release your blood sugar. So, the whole cycle is about keeping yourself hydrated, and because you're thirsty, you will drink water, right? So, dehydration. You should not get dehydrated because you need to keep your system. You need to be hydrated, and the flow of water should be so that the kidneys are not only pumping out the blood sugar, but there is also other things that's going through their system. So dehydration is not at all good, but science wise, you just get excessive thirsty.
Yeah, so dehydration really keeps your body from functioning well, is what you're
Yes. Yeah, it
so
keeps your
it's in
functioning well because the kidney functions well, right? The more water you take, your whole body functions well, and you are also with dehydration, you kind of lose your mind and your brain doesn't function properly. If you really look at it, it's a kind of one symptom leading into, or one sign and symptoms leading into another.
Yeah,
It's a bad disease, diabetes is really
yeah.
it's a bad disease, but it does not kill people immediately. So you can live with it for years and years properly, provided you manage and treat yourself properly.
Yeah, and all the more reason to be talking about prevention. All of the more reason to get to your doctor, get your A1C number, continue to monitor it, make sure you're not going into the pre-diabetes stage, and simple things like staying hydrated, getting enough sleep are so important to both
Correct.
and managing diabetes. So those are some really good points, Dr. Kuhu. Um, so let's talk about just some risk factors for diabetes. And you've been mentioning it throughout this time as well. Being overweight or obese is a major risk factor for diabetes. Being older than 45 is also a
Correct.
factor, placing you at increased risk for diabetes. If your parent had type 2 diabetes, as in your story, Dr. Kuhu, you mentioned your father had diabetes,
Right.
that places you at risk. Or if you've been diagnosed with pre-diabetes, and again, you don't have to go on to diabetes with pre-diabetes, you can actually reverse that course. So taking those preventive actions, exercising, staying hydrated, getting enough sleep, getting your weight under control, in terms of losing the excess weight is really, really important. So I think we are at the end of our talk. This has been really good, Dr. Kuhu. We talked about insulin. We talked about the types of diabetes, type 1, type 2, gestational diabetes, diabetes insipidus. We talked about the A1C number and just how important that number is.
Correct.
Not just to do your fasting glucose levels, but to know what your A1C numbers are, giving a picture of the last 3 months of your blood load as far as glucose in the blood. And also ways of preventing diabetes, losing the weight, drinking water, taking care of your diet and ensuring that you are eating healthy, avoiding a high carb diet if you are diabetic, and consuming a diet that is perhaps high in protein than it is
Right.
carbohydrates is really important for someone who is experiencing or living with diabetes. So we've covered a lot of ground, and I appreciate you, Kuhu, for coming on, Dr. Kuhu.
Thank you so much for inviting
Almost
me.
20 years, so she's Kuhu to me and lovingly so. But thank you so much for coming on, for sharing your story, for sharing your insights related to preventing diabetes as well as managing diabetes. And in the month of Diabetes Awareness Month, it's important that we talk about this issue because, like I mentioned earlier, 1 in 10 Americans actually has diabetes. So it's a very common illness to me at epidemic levels, and we need to begin taking the responsible action in our both diet and exercise, our lifestyle choices, so that we can both avoid and manage diabetes. So thank you so much for coming on. I appreciate you. And to my viewing audience, thank you for joining me. And I look forward to our next talk. Be blessed. Bye-bye.
Thank you. Thank you.
School.